Arizona on the verge of what could be a major decision on marijuana.
The idea that marijuana is harmless is a fallacy.
The battle over legalizing recreational use. Will Prop 205 help or hurt the people of Arizona?
If prohibition's been a failure, which I believe wholeheartedly it has been, then we're far better off doing something different.
Donald Trump Jr. trying to regain lost territory for his dad in this battleground state.
He's doing this because he loves this country, and he knows he can make a difference.
That and Breast Cancer Awareness Month.
It's painful. It's way more painful than the mastectomy was.
An update on patient Jackie La Madrid in the fight for her life. This is Arizona Week. Hello, and thanks for joining us. Arizona's battle over the marijuana initiative is intensifying with less than 2 weeks left before the election. And today we'll bring you two unique perspectives, pro and con. If passed, Prop 205 would allow people aged 21 and older to possess and privately use up to 1 ounce of marijuana purchased from state-licensed facilities that would collect a 15% tax on retail marijuana sales. Proponents argue some of that money would support schools.
The truth? Prop 205 gives Arizona schools 80% of marijuana tax revenues.
But opponents warn Arizona should not follow in the footsteps of Colorado, where some officials now say decriminalizing recreational use was a disaster.
Don't repeat our terrible mistake.
The 20-page initiative creates a regulatory bureaucracy and generally declares violations of the act would be a petty offense with a fine of no more than $300. 50.4% of registered Arizona voters were in favor of Prop 205. 41.6% were against it, and the remainder didn't know. That's according to a poll taken earlier this month. Using marijuana for medicinal purposes is legal in Arizona and has been since 2010. J.P. Holyoke is the chairman of the Prop 205 campaign. He took us into his grow house, which produces marijuana for dispensaries, and he says passage of Prop 205 would change Arizona for the better.
It's the difference between people's lives. There's no question about it. This changes people's lives for the better. Absolutely 100%, with the prime example and the reason why this exists being my own daughter.
Tell us about that. Some people are skeptical of its medical use.
I was one of those people that was ignorant enough to be opposed to marijuana. And it wasn't until I had my own personal situation with my own daughter that my views on it changed. Because my daughter was born as a special needs child, and when she was about 3.5 months old, she started having seizures. She was having seizures every day. Cannabis is the only drug that stopped that from happening.
And her life now?
She's doing great. She's doing fantastic. She's running, laughing, playing, smiling. She's living a very high quality of life because of cannabis.
People are really struggling with this issue. I mean, the polls show that it's nearly split in the state. What do you want to say to voters who are contemplating?
I want voters to have an honest conversation regarding the policies of prohibition that we've had now for centuries, or nearly a century in this country. I want them to say, is it working? Is prohibition a successful strategy or not? And that's an honest conversation that people need to have when they're evaluating the alternative. Because if prohibition's been a failure, which I believe wholeheartedly it has been, then we're far better off doing something different.
There has been a lot of media that refers to what's happening in other states like Colorado and Washington. Things like babies being born with marijuana in their system, car accidents on the rise. What do people need to know when they see that sort of data?
When we start looking at the traffic fatalities, which you may have seen advertised on some of the opposition's ads. Now, if traffic fatalities were actually up in those states, and certainly by anywhere near the amounts that they've talked about, you would have thought this would have been news before. We would have heard about this. But when you actually go to the Department of Transportation for those respective states, you see that overall their traffic fatalities are actually down, not up. And that's notable considering they've got greater populations and more miles traveled. So these fears are nothing more than scare tactics and fear-mongering that the data simply doesn't back up.
Is there a need for this? Is this necessary in Arizona?
Yes, it's necessary because we arrest about 14,000 individuals a year in this state for simple possession of marijuana. That's not trafficking, selling, dealing, or otherwise. Simple marijuana possession. People who are consuming something that's objectively safer than alcohol. We arrest 14,000 of those in this state every single year, and we charge them with felonies. It's an absolute waste of law enforcement time, energy, effort, and resources. And even worse, it enriches criminal drug dealers. Because we're saying, no, let's tax and regulate it and take those tax dollars and send them to our schools instead of criminal drug dealing organizations.
Take me to January if this passes. Where do we go to buy it? How does it all look?
So you won't see any changes in January. So the governor will sign this into law, the first week or so of January. That's when the law would take effect. But then the state has a year to actually do the rule-making process for the implementation of the law. And so it's not until March 1st of 2018 that you'll be able to walk into a store, a taxed and regulated store, and buy marijuana legally.
If the measure passes, Arizona could become among the first border states to legalize the use of marijuana. Every year, law enforcement in southern Arizona seizes between 800,000 and 1.5 million pounds of marijuana.
From a DEA perspective, it won't change that much. It'll still be illegal under federal law, and we enforce federal law. So we will still target major trafficking organizations that are moving marijuana into Arizona and throughout the United States.
How big of a problem is marijuana right now in Arizona?
Marijuana is the most used illegal drug in the entire country. So I think it is a significant problem here for all of us. I think it's a problem in the country. I think it's a problem here in Arizona. It's the drug that a lot of young people start off with. And I think eventually they turn to other drugs as they go through. Not all of them, but some of them turn to other drugs. But marijuana is definitely a gateway drug, and it's definitely a problem for all of us.
Marijuana still comes through Arizona. Does it go to states like Colorado and Oregon where marijuana is legal right now?
The legalization in some of those states has created a market for people to go into shops and buy that, but that doesn't mean that these cartels are going to not be in that business. They're still moving their marijuana. They're still actually supplying some of these shops. We see criminal organizations set up in Washington State and in Colorado all the time, and they set up their marijuana grow operation there because they think it's going to be safe, because they think that the cops aren't going to come after them, and then they grow there and then they ship it to another state. They're certainly not getting out of the business because we decide to legalize in a couple of states.
What are the consequences if someone has recreational marijuana and it's still against federal law? Can you explain how that works?
We have no interest in expending our resources on going after somebody with a recreational amount of marijuana. But make no mistake, it'll still be illegal under federal law, and we will still go after the biggest and the baddest drug trafficking organizations, regardless of what drug they're trafficking in. If they're trafficking in marijuana, DEA is going to be after them.
We often hear that marijuana is a starting point, but then it feeds into these bigger, more dangerous drugs. Is that accurate?
I can tell you, in all the time that I have been a narcotics agent, which is coming up on 30 years, in all those years, all the people that I've arrested, all the people that I've interviewed, I have yet to meet one that didn't start off their drug use by starting off with marijuana. Nobody wakes up and says, today I'm going to be a heroin junkie. Nobody wakes up and says, today I'm going to be a crackhead. They start someplace else and they move into that role. So whether it's a physiological gateway drug, a psychological gateway drug, or just that you get more used to using drugs and you're more willing to take that risk to try harder drugs, I can tell you that everybody that I've ever talked to, and that's a lot of people in the last 30 years, all of them all started out smoking weed.
Tell me about this warehouse right now, where we're standing.
So this particular warehouse here will run about between 800,000 and 1.5 million pounds of marijuana through here per year. We'll sample it. We'll use it for court. When the court stuff's all done, we take it out and we burn it all.
The fact that there's so much coming through here means there's still a problem in this country.
We have a lot of people that want to smoke marijuana, and I think that's why we see a lot of people pushing for the legalization now. We have a whole bunch of people that want to smoke marijuana, and as long as we have that demand, people are going to push these drugs up to us. We have a huge heroin problem going on in this country right now with the prescription drug epidemic. We have a lot of people that are getting addicted to opiates. So the Mexican cartels are manufacturing heroin as fast as they can and shipping it across. As long as we demand it, they'll send it up here.
Other political news now. Donald Trump Jr. on the campaign trail in Arizona. The Republican nominee's son spoke at Arizona State University Thursday afternoon. The speech geared toward students, asking them to turn out at the polls in 2 weeks. Trump Jr. reminding the crowd his dad is not a career politician and says he's the only candidate who can change the way Washington operates.
Thank you. You know what? I always say, my father got into this for all the right reasons. he didn't need this job. He didn't need it at all. He needed this job like a hole in the head. But you know why he did this? Because he loves this country. He loves the American dream. He loves what that stands for, and he wants to make sure that all Americans, of all ethnicities, all backgrounds, have the same opportunity that he had to start a great family, to start a great business, to not have government in every aspect of your life. And that's what it's become. That's what it's become. You have people in D.C. telling you what you should be thinking. You have people in D.C. telling you how to run your business from their backyard when they have no idea what's going on in yours. And that's got to stop.
Arizona's 11 electoral votes are considered up for grabs. Polls show Hillary Clinton leading what was once considered a Republican stronghold in the presidential race, and many Arizona Republicans have stepped away from Mr. Trump. This week, Arizona's Republican Senator Jeff Flake visited Tucson. He sat down with Arizona Public Media's Christopher Conover and says he will still not vote for his party's nominee for president.
No, he lost me at Mexican rapists way back when he announced, and I've just never been back, or never got on that train. I've always thought that he would not be good for the country, and certainly not be good for the party.
If you don't mind us asking, what are you doing on Election Day?
Well, I'm not voting for Hillary Clinton. I'll likely write somebody in, but I'll leave that until the end. So
This election seems to be splitting the Republican Party. Can the Republican Party be healed after this, and should it be healed after this?
yes, it can and it should. The Republican Party is the party that stands for limited government, economic freedom, individual responsibility, free trade, strong national defense. And I do believe that supporters of the party will come together. It may be more difficult than it's been in past elections, but I do think that we can come back together.
Different news now. October is Breast Cancer Awareness Month. In Arizona, 1 in 1,000 women will be diagnosed this year. Among those, Jackie La Madrid, a 32-year-old mother of 4. Arizona Public Media has featured Jackie's story since she was diagnosed in April. Today, Jackie is a cancer survivor and in the process of reconstructive surgery.
Yeah, I had my mastectomy in March.
This 32-year-old mother of 4 is a cancer survivor.
It's hard at first, but you can do it.
The battle, though, is really just beginning.
After chemo, everything was frustrating for me. Like during chemo, I was good, and after that,
Okay, thank you.
hi, good, how are you? Kind of all hit me like a ton of bricks. I'm happy now, my hair's growing back, and I'm getting, the reconstructive part of this over with, or I guess, at least I thought I was. It was like that last bag, the last drip, when it starts beeping, it's like those last 5 months before chemo just all hit me, and I'm just really emotional now.
Jackie La Madrid had a double mastectomy after 4 rounds of chemo. She's starting the reconstructive process under the care of Dr. Ethan Larson.
Hello.
Hi, how are you?
I'm good. How are you doing?
Good, thank you. It's painful. It's way more painful than the mastectomy was. So like I said, I just want to get this over with, but then I don't want to rush anything because he knows what he's doing.
Good.
Dr. Larson says Jackie is experiencing delayed healing, not out of the ordinary.
She had some areas on the incision that were a little slow to heal. And so rather than risk an infection, we decided to cut out the areas that were healing slowly and then reclose it. Stitches went in on Friday.
A small setback. It's important to do this right.
Every other suture. You can only push the body so far. It needs time to heal. And we've got to give you time to heal before we start asking you asking the skin to expand and to accommodate a new implant. So there's sometimes these things take time, and we have to give them time.
Frustrating for Jackie, who drives up from Douglas, a town that recently closed its only hospital.
But it is getting very annoying that I can't just go to the doctors in Douglas 5 minutes away from my house, that I have to travel 4 hours here and back every single time.
Get it down.
Arizona Public Media has featured Jackie's story since April.
Bye, Anna. Bye, Anna.
A wife and a mom, it's a careful balance for her family.
Roberto is putting up with me. Thank God he hasn't run out on me yet. And the kids are doing good. Oh. Romy's back at my house, and so now I have her with me every single day. I don't have to share her with anybody, and I think that's helped her a lot because she went through, even though she doesn't know, she's been through a lot for the last 6 months.
An army of support at home, she relies heavily on her parents, her in-laws, and her 4 children.
Thank God, because I don't know what I'd do without them, but it's getting really old. Then I say that, and I'm like, I shouldn't even complain, because I'm still here to talk about it. So it's a roller coaster, up and down.
You don't need antibiotic ointment, nothing like that.
One day at a time, and a long road to recovery.
On Friday. I think maybe I just need time off from all this whirlwind. But I don't know. 2017 has to be way better than 16, so.
As you heard Jackie say, emotionally she's managing some tough days. Dr. Karen Weiss is a psychiatrist who works with cancer patients at the University of Arizona Cancer Center.
Earlier on, they're so busy just getting through the chemo, coping with everything, making decisions, that they don't really have the attention to give to paying attention to, well, what have I gone through and what does this all mean and now what for my life?
Jackie has noticed that the attention toward her and her care and her needs is sort of fluctuated.
And in a scientific perspective, I think of this as the attachment and caregiving drives. Those are normal drives that all human beings and in fact mammals have. You know, when there's danger of a close family member, it activates the attachment drive, which means that we seek our caregiver, and then the caregiver has a drive to take care of the person who needs to be calmed and protected.
Is the solution in things like antidepressants or bereavement or counseling groups? I mean, what is part of this solution?
I'm currently doing some studies on depression in breast cancer patients and published some things recently. And what we found is that about 40% of breast cancer patients are at risk of having a depressive episode or staying persistently depressed throughout their cancer course. Jackie was not depressed and didn't feel down initially. Re-entry phase blues is not that uncommon. And so for those people, counseling can be useful, and if they have significant enough symptoms of depressive disorder from a psychiatric perspective, then we know that they could improve more quickly with a medication than without a medication.
Does your research show that body image plays a role?
Absolutely, yes, because women know who they are based on their body. And as women, we have a sense of ourselves based on our figure and our breasts with which we nurture our children. So when breasts are impacted by breast cancer, it can really change a woman's sense of who she is. It's part of her self-image, and her body image is a big part of that. And that can be very difficult.
It's not fair to assume that just because a woman has a reconstructive, she's cancer-free, everything goes back to normal.
There's a confrontation with the fact that life is different now. I am a breast cancer survivor. I'm never going to be a woman who hasn't had cancer. I'll always be a woman who's had cancer. And that's a different identity. And coming to grips with the fact that that's different. It's a new normal.
Survival rates continue to improve. Dr. Joyce Schroeder is a researcher in the U of A Cancer Center, one of the leading research institutions in the country. She says fundraising for cancer research is making a big difference in her work.
So breast cancer research has actually made a lot of strides in the last 10 to 20 years. First, in really identifying what are the drivers of breast cancer. So a lot of efforts have been put in to try and understand what are the different types of breast cancer. So a lot of times when a patient gets diagnosed, they'll say, I have stage 1 and my physician told me that's good. I don't actually know what that means. I have stage 4 and my physician told me that's bad, and I don't know what that means. And what we do know now is really what are all the things that are behind that.
In your research, what has really been most fascinating that you've learned about cancer or breast cancer that maybe we didn't realize was part of this disease?
Cancer isn't really just one single cell that has mutated and gone bad. It's actually encompasses all the tissue around that cell. So it's a disease that brings in all sorts of aspects of your body. So it brings in the immune system, the tissue in which it lives, the vasculature. They're all having a really complicated interplay to promote cancer and to keep the patient from being able to respond well to therapies that we have. So a lot of focus is really trying to understand how all these different components of the body are working together to make the cancer so difficult to treat and understand.
Do we give ourselves cancer, or how does this happen?
So that's probably one of the misunderstandings that most of my students that I teach in my undergraduate class come with. They think, oh, did I do something wrong? Is that why I have, did my uncle do something wrong and that's why he has lung cancer, prostate cancer, what have you? So we can take aside the environmental things that we know about. For example, smoking definitely causes lung cancer, but there's also people who get lung cancer who have never smoked. Most people get breast cancer. There's very few strong environmental factors that are driving it. What we know instead is that as a person ages, you naturally develop mutations in different functions of the cell. And some of these the body can repair and move on, and some of them the body can't repair.
Where's the U of A Cancer Center fall in all this research? I mean, where are we on the spectrum?
The U of A's Cancer Center is a comprehensive cancer center. There's a limited number of those across the United States, and one of the benefits of being a comprehensive cancer center is that funding comes from the National Cancer Institute to support not just research, but also services that sort of allow deeper collaborations amongst the scientists and the clinicians, and hopefully will promote those discoveries into translations of therapies for patients. One of the benefits of being at a comprehensive cancer center is that a lot of times if you're at a university without a comprehensive cancer center, you're doing the science, but you're not exposed to the clinical side, and you don't interact with the physicians who are interacting with the patients. And vice versa, the same is true. If you're out in the community as a physician, you're not interacting with the scientists, so you're not talking to them about the latest discoveries and what's been recently done and what can we do to translate these discoveries. And so by being at a comprehensive cancer center, you can bring all those pieces together. And a lot of novel imaging techniques have been developed here so that patients can be diagnosed earlier, more accurately, that sort of thing. We have a lot of phase 1 clinical trials going on here so that discoveries that are made not just here at the U of A, but at other places around the world can be brought here and given to our patients. So, for example, new therapies designed to target new ways that we've discovered cancers interacting with the body. Let's say it's been discovered at an institute in France. We have a great phase 1 clinical trials office here where we can bring that new drug here and give it to our patients here as well.
Our diet and exercise play a big role in how our bodies respond to cancer treatment, and in some cases can fight off cancer cells. Tracy Crane is a nutritionist who works with cancer patients.
Mother Nature has provided a plethora of different plant sources of all these phytochemicals and cancer-fighting chemicals, really, that can help ward off cancer cells, help your body to fight cancer better, whether you have had a history of cancer or maybe you want to prevent the risk of cancer.
What are some of the other things we're doing in our lifestyle that we may not realize are so dangerous?
So the number one cause of cancer and all preventable chronic health conditions is tobacco use. So the first thing I tell people is if you use tobacco products, quit using tobacco products. That is the first thing you can do to lower your risk of a myriad of chronic diseases, including cancer. And a resource here in the state of Arizona is the Arizona Smokers Helpline that frankly is underutilized, and you can get support to help you quit smoking.
What about exercise? That is a major component that we often don't talk about.
Yeah, so exercise is really important in an overall healthy lifestyle, and you really want to be trying to aim for 150 minutes per week of moderate physical activity. Some people say to me, well, does that mean I've got to go out and join the gym and I've got to be training for a half marathon? No. It means that you're going to be getting up and moving for at least 30 minutes every day. And people will often also ask me, what is the best exercise? And it's the one you will do.
Jackie's in her early 30s. She has 4 young children at home. This really is that new lease on life for her, but she's got to be committed to maintaining a healthy lifestyle.
I think talking to your family is really important about your commitment and your desire, and that these changes in their lifestyle and maybe how they eat dinner together. So maybe they're not going to have hamburgers at McDonald's anymore. And the reason for that is because it's going to help mommy to fight this cancer better and maybe not get it again.
I think she probably looked at it as, I can't have this anymore. But you said there's actually a different attitude or approach that you should have.
So I work with a lot of cancer survivors, and one of the things that we try is to think about adding to your diet versus taking away, or adding activity to your diet. So what I mean by that, if you think about wanting to add in plant sources or adding in some of these good, healthy, heart-healthy polyunsaturated fats like omega-3s from salmon. So you think about adding in these things. Maybe adding in, we haven't talked about this yet, but another really great food is like there's all your teas. So black tea, green tea, white tea, these can be easy things to add in to help increase the phytochemical composition of your diet. So you're trying to expose your body to as many of these cancer-fighting nutrients found in foods that you can.
Back to Jackie La Madrid now. Her reconstructive process has hit a bit of a speed bump, as you heard her doctor say, but the 32-year-old is not giving up hope that one day soon she'll put this chapter behind her, as she told us when we first met her.
I am very blessed. I don't look at this as a burden. I don't look at this as a curse on myself. I look at this as a second opportunity to do my life completely different and to let all negativity go and to be thankful for everything you're blessed for. Every day is a new day, and that's just it. You got to move forward from there.
And that's our program. On the next Arizona Week, just 2 weeks until America elects its next president. We'll have the latest political news, including Arizona's role as a battleground state. For all of us at Arizona Public Media, I'm Lorraine Rivera. Thanks for joining us.